I and the governor met with the Colorado Medical Society and doctors across the state just last night, asking for their support, knowing that the trusting voice of the physician can really help answer questions and get people to choose to be vaccinated. So my plea and my ask, of course, is that those of you who have not been vaccinated to sign up and to quickly be vaccinated. It's working. It's getting us back to our normal life. And I think it's a disappointment to see cases going up and hospitalizations going up, knowing that this is happening among the unvaccinated at a time when we have the supply and we have a very effective vaccine at our fingers. So with that, I'll turn it over to General Sherman to talk a bit more about vaccine supply.
All right. Hey, thank you, Dr. France, and good morning, everybody. Just wanted to give you 2 slides, quick update on vaccine distribution update. So for Pfizer, total vaccines received almost 2.3 million. Moderna, a little over 2.1 million. And then 285,700 of the Johnson & Johnson vaccine. Cumulative doses distributed throughout the state, both through Colorado jurisdiction and the federal allocation, approaching 4.7 million cumulative total doses. And then doses administered, 3.946 million. So we'll be over 4 million here later this week, either today or later this week. And of that, that's those doses also include the 33.9% of the population that's fully vaccinated, or I should say the eligible population fully vaccinated that we reached last night. Next slide, please. Just wanted to show you daily doses administered. We still have an upward trend, and that's really even with the Johnson & Johnson vaccine not being able to be administered. We're becoming more consistent daily allocation or daily administration of vaccine, approaching 60,000 average every day on vaccine, except for Sunday. So Monday through Saturday, we're averaging over 60,000 doses a day. And with that, we'll hand it off to Brandy Emily.
Good morning. Thank you for having me today. Next slide.
Sorry about that.
That's right. So I just wanted to come and share our vaccine equity plan at the state level. We have a mission for vaccine equity, and that is based on using a data-driven approach to meet people where they are. Next slide. So I wanted to start by showing you the overall demographic data. This data is available on our website and updated every day. It's no surprise that the data shows more of our white, non-Hispanic Coloradans have been vaccinated than any other race or ethnicity. We know that there are many factors that contribute to this, including access and connection with primary care and providers. And we also know that we started with our healthcare workers and teachers, and that helped to widen the gap, as we know that those are largely white occupations. So as we've moved into frontline workers and opened into phase 2, we're hoping to eliminate some of the barriers to access, in addition to misinformation that we know has played a role in uptake among our Black and Brown communities. So we've implemented several work streams to help close these gaps. On this graph, you can see that the yellow bar shows the percentage of the population that each race makes up in the state. The orange bar shows the percentage of the total that have been immunized. So we can see that Hispanics make up almost 22% of the total population, but only 8.6% of those who've been immunized with at least 1 dose. Our Black and African American population makes up next to 4% and has been under vaccinated as well at only, 2.5%. Asian Americans make up 3.1% of the population and have been vaccinated at 2.9%. And our white non-Hispanic Coloradans make up 67.8%, but have been vaccinated at 70%. The state of Colorado, next slide. So the state of Colorado is divided into 1,249 census tracts. So when we talk about a data-driven approach, this is what we're looking at. We look at these tracts and we look to where we should focus our efforts. We have determined that the rates of BIPOC and poverty based on social vulnerability index from the 2018 census data is where we are focusing our efforts. From November of 2020 through February of 2021, the hardest hit areas of the state fall into these identified census tracts where we focused our high proportion of our efforts. These tracts include 42% of all COVID-19 cases, 48% of all deaths, and they include 61% of all BIPOC cases and 65% of all BIPOC deaths. In phase 1, we narrowed our scope to 426 tracts. These 426 tracts cover 34% of the state and 38% of the total state population. They also include 53% of all Coloradans living in poverty, 47% of all BIPOC Coloradans, and 68% of those BIPOC Coloradans living in poverty. And of that, 87% of BIPOCs over 65 living in poverty lived in those 426 tracts. So that made perfect sense for phase 1 when we were focusing on our 65 plus. Now that we've expanded to phase 2 and are open to all Coloradans over the age of 16, we've expanded that work to 460 tracts. This still covers about 34% of our state census tracts, 58% of the total population over 18, 67% of Coloradans living in poverty, 60% of our BIPOC Coloradans, and 80% of BIPOC Coloradans living in poverty. Next slide, please. So when we break down the state according to those 1,249 census tracts, this is what it looks like. This map demonstrates our uptake of all Coloradans over the age of 65. This is a group that was prioritized early on in phase 1 because they were the most highly impacted. And we had a goal of vaccinating 70% of our 70 plus by the end of February and 55% of 65 plus by March 5th. We were able to meet and exceed those goals. We did a great job reaching our goals with these groups in the general population. And as you can see on this map, there's a lot of green. So on these maps, green is good. That means we're doing a good job of immunizing people in those areas. Red is bad. So there's a gradient. And there are minimal pockets of orange and red on this map. When we look at the 426 identified census tracts, we did a good job on the general population. Next slide. So now if we look at the top census tracts, these are the 426 around the state. Again, we did a good job of reaching everyone. Next slide. And now when we look at the map, according to just our BIPOC communities over 65, the map begins to change a little bit and we see a lot more red and a lot more orange all over the state. Next slide. And when we narrow that down again to the top 426 census tracts, we can see that we did a good job of getting vaccine into those communities. There's not as much red and orange, but it's not as green as the overall general population. We have a lot of work to do, and there's still a lot of orange and yellow. Next slide, please. So now we get into the state's program, our equity program. It's multifaceted. There's several layers. 15% of the vaccine that comes into the state is set aside for equity focus. This includes partnerships with community-based organizations, in addition to providing vaccine to our safety net clinics and providers and our LPHAs that are identified in the census tracts. We've partnered with organizations, counties, and providers to reach our highly impacted communities. A large effort and focus has been given to supporting pop-up clinics around the state. We've partnered with community-based organizations, including churches, schools, community centers, and small clinics to host vaccination events. We've also created a base layer of allocation for our community clinics, small hospitals, and LPHAs. So some of these providers can plan appointments in clinics with an expected amount of vaccine each week. Recently, we launched our mobile vaccine buses. The first 2 buses set out on April 2nd. We have contracted 4 buses, but launched the first 2, one in the Northeast that started just outside of Greeley, and one in the Southeast that started outside of Pueblo. Those 2 buses have been running the last few weeks in loops around those areas. We'll be launching the 3rd bus this weekend. It will tour through the Western Slope, hitting Breckenridge, Dillon, Keystone, and Silverthorne to start. The Southeast bus will also be starting to visit some of the metro area a couple of days a week. And our final bus will launch in the next week and will be scheduled through the Southwest with stops in the San Juan Basin, San Luis Valley, and Walsenburg. Additionally, we partner with our local providers who have mobile resources as well, who are able to reach small communities and to reach focused populations. Another great resource we've stood up has been our outbound call center. This has been extremely helpful in filling appointments in the community clinics that have openings and are unable to fill all of their appointments on their own. We've also utilized our outbound call center to fill appointments at our larger CVS sites to provide access to people that encounter barriers. We know that COVID has increased use of technology, and this is a barrier for some of our BIPOC communities. Everything has gone virtual, but not everyone has access to technology. So by calling outbound, making outbound calls, we can reach certain communities and fill appointments over the phone and help people find access. Additionally, we can help support transportation needs through our contracts with RTD and Lyft. And finally, we've continued throughout the pandemic to provide education around hesitancy. We know that hesitancy is decreasing, as our surveys have shown. This work was started before the vaccine was even available and has continued. We've developed a really robust Champions of Vaccine Equity program within CDPHE. This is a partnership with trusted providers of color in the community who host webinars to provide education around vaccine safety and effectiveness. They provide a trusted voice. They listen to concerns, they answer questions, and these events have been really impactful. We've reached well over 1,000 Coloradans through community-based organizations and employers who've requested these webinars. And the last thing I want to touch on real quick are some numbers about our pop-up clinics and recurring sites. Next slide, please. I mentioned earlier that one of our largest work streams has been to support pop-up clinics around the state. To date, we have been able to support 660 of these pop-up clinics and have distributed more than 268,000 doses. We also have 8 smaller recurring sites. These are in communities that have been highly impacted. They happen once or twice a week, and we've distributed about 11,000 doses to those recurring sites. We have been able to reach 159 of the equity tracks that I mentioned earlier and 42 of the top 100 equity census tracks. Next slide. And last, here is a map that just gives you a visual representation of where our equity doses have been distributed around the state. And with that, I would like to pass it on to my colleague, Maisha Fields.
Thank you so much, Brandy. My name is Maisha Fields, and I am a nurse practitioner, and it's my privilege and honor to work in collaboration with all these phenomenal people. And I just want to say, whew, oh my gosh, 660 clinics and over 266,000 people vaccinated. And that is a huge effort, because it took this entire team and a cohort of community organizations who have a track record serving communities of color, providing wraparound services for people of color, for vulnerable populations, connecting with our federally qualified health centers like Salud and Clinica Tepeyac and Clinica Campesina and several others who are part of the CCHN network, connecting with churches and pastors and saying to them, we need your help. We need your help to get shots in the arms. And one thing that we know that has been so eloquently demonstrated today is that people of color face far more barriers to get access to healthcare. We know that as it relates to primary care, and we know that as it relates to getting vaccinated. And so this equity task force is really meant to make sure that people of color, Black, Indigenous people of color, are not put at the back of the line, that they didn't have to wait, that there was intentional outreach to their communities and to trusted leaders who could provide a proof point that it's okay to get vaccinated, that you can trust the vaccine, irregardless if it's Johnson & Johnson, Moderna, or Pfizer. And so I want to recognize that this work is also done in partnership with former Councilwoman Elba Wedgeworth and Nita Gonzalez, champions in the community who have a track record of being leaders and providing trusted information to the community. We have noticed that there has been a lot of hesitancy in the community. And one of the successes of the clinics, of having 266,000 shots in arms amongst a hard to serve population, is making sure that we have influencers. And so I'm proud to say that we worked with the Denver Ministerial Alliance to have several clinics at Shorter AME Church, at New Hope Baptist Church, at the Park Hill Golf Course, and also some churches at Grand Memorial, which is a Kojic church. And throughout these pop-up clinics within churches, we were able to reach a hard-to-serve population. And I'm proud to say that today we are launching our mobile clinic in the Denver metro area. And so that mobile clinic will be in Montbello today, and tomorrow it will be in Aurora, off of Colfax and Chambers. So we're excited about the mobile clinics. We're excited about going to where people need services, barbershops, grocery stores, Taco Bells, where we know we have the hardest hit population of essential workers who oftentimes can't take work off to get vaccinated. So we're going to their communities, we're going to their leaders, and we're making sure that we're getting shots in the arms for the people who are the hardest to serve. And with that, I'll turn it over to Linda, who has done a phenomenal job helping to vaccinate people in the Latinx community, working with churches and community-based organizations as well. Thank you, Linda, for all that you do.
Hi, Linda, you're still muted. If you could unmute yourself, that'd be great. Thank you.
Okay, you hear me now?
Yes,
We
we
do.
can.
Okay.
Thank you, Linda.
Thank you. Hi to everyone. And I'm very happy to be part of this team. Thank you to Anita Gonzalez. Anita was the first person contact us, and Serena Moreno. They came over here to San Cayetano to help this community. And I am very happy, and my own experience and what I find out is technology to register. And I invited the people to come to the church and sign in person, and they came and they were successful. I have 100 people every single day, or 150 to sign it. So they take me 2 weeks to have 2,000 people, or more than 2,000 people signing for the vaccination clinic. I started in April, and I see the process. And the first one, there was 1,500 people, and the second one, there was 2,000. Now is 1,000 each time. Now Saturday and Sunday. So, and I still have a waiting list, and they're still calling me to sign in. It was very successful, and I'm so happy to help all of you and all the human beings. It's not the only Latinos or Chicanos or Americanos. I think it's COVID-19. It's a pandemic. We need to make conscience to the people that we saving lives. So all the volunteers that we have to do at the clinics, they are so happy. The young people, very, very young, because they know we're not doing like regular clinics, you know, we're saving lives. And to to make conscience to the people, if they save their own lives, they can save the family's life. I see families suffer for the COVID and die. So my heart is with the community is to make the difference. We save a life, and we all together we can make it and come to our life again and go see grandma and go see the family, have a barbecue, hug each other. The pandemic make us stay home, and there are a lot of people depressed. They are lost. They looking for companies. They making a lot of mistakes. So what are we thinking? And what I'm thinking is to make the difference, to send the message, to get vaccination, and put your arm and save our lives. And now the community, they answer very well. So I will keep it in there, and thank you for all the your support, and thank you for save your lives and put your arms.
Linda, thank you so much. We appreciate everything that you're doing. And I know that this brings you so much joy, which of course brings us joy. And so with that, we're going to go ahead and go over to our Q&A. So those of you who have joined us before for the media Q&A, how this works is we'll use the raise hand function. I'll call on you, and if you could say your name and the outlet that you're with, and then we'll get through as many of you as we can. I would like to start with all first questions, and then we can do follow-ups as we move on, just to make sure I can get through as many questions as possible. And so we will start with Seth.
Hi all, Seth Klayman with the Gazette. So you guys describe all these equity efforts and everything, but the rate of Hispanic vaccination still seems really, really low. So what's going on there, and are you confident that the strategies you've laid out will be able to address that?
So we are clearly aware that we are falling behind in our Hispanic communities, and we have partnered with lots of community organizations and partners in the Latinx communities who have plans to reach their communities. So we continue to do the work. We know that we have a uphill road to toe, but we're committed to doing the work, and we know that we are making progress in these areas. Our buses are a great resource in this effort, as they are able to go to employers. We've had several businesses reach out, and we've been able to take the buses to places of employment and reach people right where they are. We know that one of the barriers has been time off and access, and so going like we've been saying, to where people are is going to be a great resource as we have these mobile clinics out in the communities.
And just to add all the things that Brandy mentioned, one of the things that we realized early on was the technology barrier, and also barrier to cell phone access to call and make an appointment, especially as Brandy said, if you're working and you can't call and you're online for an hour or two to get an appointment, and you got to get back to work and you only have 15 minutes to make that appointment, that was a barrier. Having a cell phone that could download a QR code, languages, and not having the appropriate people available to have appointments and to speak with people who speak your own language. And so we have been aggressively working to develop partnerships with organizations who are led by people of color, who speak the same language and who are trusted. And so we're excited to announce that we are developing a whole new messaging campaign and providing greater language access and services, and also making sure that we eliminate barriers. And the mobile van and also having walk-up appointments is one of the things that's going to be critical to increasing the number of Latinos who are going to be vaccinated at their job site or at the grocery store that they go to.
Great, thank you. Chris, we'll go ahead and go over to you.
Chris Vanderveen with 9 News. It's probably a question for Dr. France. Does the state have a specific level of vaccination and immunization where you're going to feel like this is largely over, that people can feel safe going back into work, going back into large crowds? Do we have a level of where we're trying to get to where we're going to feel pretty good about where we are, knowing that we're never going to get to 100% vaccination? What is the level that the state is shooting for?
I'd say that the level the state is shooting for with vaccination is actually combined with the rate of cases in the state. And so as we try and get to the maximal level of vaccination, we expect cases to come down. And so one really feels like you've made it when you know you have high rates, and as a consequence, the number of cases have been falling. We expect 8 of 10 Coloradans would like the vaccine, and so that's what we're shooting for. My hope is that by middle of summer, we'll be at 75% and continue to progress into the fall. And with those high rates, we will see that the cases are actually falling precipitously across the state. And that makes us all feel like, oh, okay, we're ready to go out and really be back to our normal life.
Great, thank you. Taylor, let's go to you.
Hi, Taylor Summers, NBC News Radio. It's kind of actually a follow-up to what Chris was asking. I've been seeing these reports from other states saying that they're not feeling confident that they'll be able to hit this level of herd immunity. Dr. France, how confident are you that we may be able to hit that level of herd immunity, considering we do have this hesitancy among certain demographics?
Confidence is probably about a 7 out of 10. You're asking me to predict the future. I do know from the past history of new vaccines, the first year or two can be a year where people kind of accept it, but then pause, and then over time, acceptance rates go up. And so we've seen it improve over the last year, the number of people saying that they'll be vaccinated. I think last September, over a third were saying they would not be vaccinated. Now it's about 20% saying they won't be vaccinated. So it's getting better in that regard. Time will tell. I do expect the numbers to continue to increase, especially once we're moving to our clinic-based vaccines, doctors talking with patients. We know that the best way of helping someone make a decision to vaccinate when they have questions is to talk with their doctor, and that really does improve the rates.
Great, thank you. Seth, before I go to your follow-up, I'm gonna go ahead and go to Evan's first one.
Hi, thanks for taking the time for this. In the past 9 days, the number of first doses out of 2 as a metric has been going down. What do you think explains that? Is that going to be a trend that you believe continues? Are we seeing the demand side change on vaccinations?
I could take the first part of that. So it just happens to be in our time frame of Moderna and Pfizer that we just have a lot of second doses that are scheduled during this time. And with not having the Johnson & Johnson vaccine on hand or able to use, it has decreased our amount of vaccines that we can do. The J&J, just with the problems that came up and the ACIP decision that has to be made, that has hurt a little bit with getting people vaccinated and wanting to get vaccinated. So, like I said, we're still averaging 60,000 a day. But, we're going to use all our efforts in the state to make sure people understand that the vaccine is safe. please come get your vaccine and get this done. And like Dr. France was talking, is really getting this stretch of people that are less willing or more hesitant than the general population on getting vaccine, and getting the vaccine to them and make it as easy as possible for them to get their vaccine and get completely vaccinated.
I might add that a big vaccination program like this will look like any big change in an organization or in a community. There'll be people who quickly want to be vaccinated. There'll be a majority of people that will be right there with them wanting to be vaccinated. And then there'll be this phase of folks who are still thinking about it, but they haven't quite done it yet. And then finally, there'll be a group of people who are just not really interested and won't be interested over time. And so you would expect the demand to be high at the beginning and then to slowly level off and to become consistent. And then it becomes very difficult to increase those numbers even more, because the remaining folks are those who have already decided they're not interested. And so I would say we're in this transition phase, or at least entering into that transition phase, from the group of people who demand it early to the group of people who are thinking, well, I want to talk to my doctor, I want to see a little bit more. And that's going to take a little longer, and we'll see some flattening of the demand curve when we move into this next phase.
Great, thank you. John, Frank, we're going to go to you.
Thanks for taking the time. Just wanted to get an update on some of these clinics that have been shut down when it comes to storage. I understand that there's the one in Colorado Springs that we've all talked about. Then there's these couple up in Westminster area. Are there any additional ones where you have found problems and had to shut them down or seize their doses? And what is the latest that you are telling people that may have received their vaccines from those clinics up in Broomfield and Westminster? Thank you.
Yeah, sure. So on April 16th, we temporarily suspended 4 out of the 5 advanced urgent care and occupational medicine locations, as you were talking about up north here. And really it was their approved storage units were not maintaining the required temperatures. You know, they just weren't stored at the right temperatures, and they could potentially lose their potency. So we suspended 4 of those 5. Now, of the vaccine manufacturers, both Johnson & Johnson and Pfizer have completed their review of advanced urgent care storage temperature data and concluded that all the administered vaccines, both Johnson & Johnson and Pfizer, were viable, the ones that were given. We continue to wait for for guidance from Moderna on the doses that were given at the advanced urgent care clinics. So at this time, you know, people that received both Johnson & Johnson and Pfizer, they don't have to get revaccinated. If they got their first dose there, it's still good. They'll just have to find another location to find that second dose. And then for anyone that received J&J, that was good. It was a good dose. So we're still waiting on on Moderna, and we'll get that data out as soon as we can. And you know, there's still one clinic available. It's at their Brighton location on Purcell Street, I believe. That's still they met all the requirements, and they're continuing to administer vaccine. But we ask anybody, if you do need your second dose, please go to our website or go to any of the websites or our number to get an appointment rescheduled so you can get that completed on your vaccinations. And as of this time, from our inspections, we don't have any other locations that aren't meeting the requirements on their temperature data and making sure they have the right refrigeration in place to make sure the vaccines are viable.
Great, thank you. Steve Steger, we'll go to you.
Hello, General Sherman. I wanted to ask you a quick follow-up to John's question. Can you take us through how you got to the point of needing to look at advanced urgent care? I know that you stepped up inspections after the incident in Colorado Springs, but was this an issue of reviewing their temperature logs, and are you in the process of reviewing logs for all providers? Like, where are you in that process?
Yeah, actually, we still have 200 out of the 1,440 of our providers that we're reviewing right now. Yeah, we did review their temperature logs, and we were also having some issues on making sure that their inventory was correct, what they have on hand, how many they'd administered. And we sent an inspection team there and first noticed some issues out at their Adams County Fairgrounds location. And from there, we just decided right when we did that, we went ahead and inspected all 5 locations, and that's where we found those issues. So yeah, so we still are doing 200. I think it's 205 exactly. We're working hard on that to get those all completed. But so far, those are the only ones that we've had any issues with.
And can you, I'm sorry to ask a quick follow-up, but can you specify, are you looking at places that use this same kind of refrigerator? I know the Dr. Moma Clinic and Advanced Surgery both use that refrigeration between 2 and 8 degrees Celsius. Is that a common problem for you?
It's making sure it's an approved refrigerator, which that's what they have to agree to, or they have to make sure when they sign their forms and that they have the right refrigeration, one of the approved units from CDPHE. So they had that. What it was just making sure their temperature logs are correct. They kept it, the Johnson & Johnson, all these are refrigerated between 2 and 8 degrees Celsius. And when there's variances or excursions, that they quickly remedy that so it doesn't, it's out of the time frame that the manufacturer requires. And that's where we found out problems here, investigated it very quickly and found out there were some issues, and did the investigation with the manufacturers. And we've heard from Pfizer and Johnson & Johnson that those doses that were administered were good because when they were administered, the temperatures were correct. So we're working with that throughout the state, making sure there's no more issues.
Great, thank you. And it looks like I might have time for one more. I think, Seth, did you have a follow-up? I think I can take it. If not, and we didn't get to your questions, please send those over to media_info@state.co.us, and we will get you answers from our inbox. But I think I can take Seth. I feel like I accidentally lowered your hand.
That's okay. Yeah, just a quick kind of follow-up. When we look at that demographic data and the various breakdowns, is there an idea of what the unknown field is? I mean, is there an idea that maybe that breaks down sort of across the broader population? Is one demographic maybe making up more of that unknown than others? Is there any clarity you can provide there?
Yeah, since I don't think we have insight into that unknown category, we've tried to find ways of reducing the size of the unknown category, but it still remains. Maybe the other thing I'll just call out when you see that first slide that reminds us that 22% of the population of Colorado is Latinx, and that our vaccination rates are low, it's clear that the rates have been low in our Latinx population. And it's also clear that if you look at our general population of Latinx, it is a younger group than the general age of the Colorado populations. And so starting off as we did with folks 70 and older, then 65, then 60, we know that there are only 10% of people over 70 who are Latinx in our state. It's not 22%. So as we expand vaccination in ages, we'll be naturally getting more Latinx folks vaccinated as well. And so the number is a little skewed, but it still represents the fact that we could be doing better.
Thank you.
Great, thank you. And thank you all for joining us. I want to thank all of our participants as well as our interpreters and